So yeah, please feel free to email me if you've got any questions after the talk. My email address is just at the bottom there. So really important questions, and a question that I don't think people have paid much attention to over the previous decades. Does the treatment of facial angiofibromas actually make a difference to patients with TSC? And I came across a really interesting study just published this year that specifically looked at the impact of angiofibromas on patients and their self-esteem and just their sense of well-being. And it was only a small study, but I think really important. And they found that even using sirolimus gel for 3 months, which is now known to be very effective angiofibromas, there was a significant improvement in 3 score systems that they used to measure mental health and well-being, and a general health survey called SF36. So it's clear that angiofibromas have a really important impact on people's lives and that we should be treating them. So what's the evidence so far? So as of 2019, about 26 reports have demonstrated improvement in angiofibromas treated with topical sirolimus. Only 3 of those are randomized control trials. Randomized control trials are considered the standard of clinical study where patients are only randomly allocated a treatment cream versus a placebo cream or a dummy cream. And generally the person giving out the cream and the person using the cream doesn't know whether they're receiving a treatment cream or a dummy cream. And that's why it's considered the standard of clinical study, because there's no bias involved, either by the person who's assessing whether there's improvement or not, or the person with TSC themselves who's putting the cream on. So of the 141 patients that are included in all of those studies, a really good number were children, so close to 2/3, and about half were male, so obviously about the other half were female, so a good balance of men and women and girls and boys. The concentration of the cream used varied a lot. So between a cream that was made up as weekly as 0.1% rapamycin or sirolimus and 2 applications a day. And the treatment time on average was only 16 weeks, so quite short studies, and the longest study has been 24 weeks, so 6 months. Really good news though that 95% of people have significant improvement in their facial angiofibromas, which is really exciting. They only had follow-up data after those studies for 20 patients, and most of them developed new growth of the angiofibromas after stopping the treatment. So it's something that will probably need to be continued in the long term to keep the angiofibromas from continuing to grow. So what we don't know is how much cream to apply, so what concentration is ideal and how often it should be applied. And all of the studies that I've summarised in the previous slides have used different concentrations, and that's been a bit of a frustration for us. So something as weak as 0.003% to 1% shows improvement, but you know, what's ideal and what's the minimum amount of sirolimus that you should be putting on to give you improvement without risking it being absorbed into the bloodstream, and that's the big question. So just to let you know, this is the most recent trial, was published in 2018, and it's the biggest trial. So this wasn't included in the summary I just showed you, and this is a trial where there was an Australian centre included, but most of the centres were in America, and they had a rigorous randomised controlled trial design and showed that there was really good improvement in the facial angiofibromas, especially for the 1%, which is clearly superior to the 0.1%. But even then, there's a huge difference between 0.1 and 1% in terms of concentration. Reassuringly, it was really well tolerated, the cream on the face, and no person in the study had evidence of absorption of sirolimus into their bloodstream. In the study, people published some examples of the types of change that they saw in their patients who were part of the study. So as you can see, people with very severe facial angiofibromas, and the top photographs are before treatment and the bottom photographs show the results after treatment. They probably need to carry on a bit longer, as you can see, and they'd probably result in really good outcomes. So the question is, why should we do another study? Well, as I was saying, unlike some of the earlier studies, they haven't met the rigorous standards that are needed to register a new medicine for treatment, especially with medicine regulatory authorities like the American FDA and the European agencies. And that's why we're partaking in this new study, and Christchurch has set up a centre for it. So what is the study? Well, the studies are what's called a phase 2/3 multi-centre, double-blind, placebo-controlled, randomised control trial. So that means there's a study that is studying 3 different creams. One of the creams is the 1% concentration, the other cream is 0.5% concentration, and the other cream is a dummy cream. And neither the doctors giving out the cream or the people who are having the cream put on their angiofibromas have any idea which cream they're getting. And the decision is made by a computer which just randomly allocates a number to that person. And it's not till the end of the study that people find out what they were using. So there's no risk that anyone can be biased about what the results might be or how good their face looks. So what are we measuring? So we're looking at how good the 2 different strengths are against each other and against the dummy cream. And we're looking at how safe it is to give those creams in those concentrations by doing blood tests along the way to measure the liver function, the kidney function of the person, and also the levels of sirolimus in the blood, if there are any. So to be part of the study, it was decided essentially that you should be at least 6 years of age and less than 65 years of age on the day that you become part of the study. And anyone with TSC who has facial angiofibromas in the moderate severity stage is able to take part. So the study investigators decided to not include people with really, really, really severe angiofibromas, because it may be so severe that the difference is not appreciated once they start the cream and only use it for 6 months. And saying that they've decided not to take people who've got really, really mild angiofibromas and maybe only 3 or 4 on the face, because it's not a severe enough manifestation of angiofibromas to be able to appreciate a difference, especially the difference between the 2 cream concentrations. Not that they wanted to exclude people. And anybody can take part who is interested around New Zealand, so that's a really exciting thing. If you've got broken areas of skin or wounds in the areas of angiofibroma, it wouldn't probably be safe to take part because of the potential for absorption into the bloodstream. So we wouldn't take those people unless they were healed. If you're on an oral mTOR, so that's everolimus, for example, for kidney angiomyolipoma or other manifestations of TS, you wouldn't be eligible because the tablet therapies generally do treat the facial angiofibromas from inside out, so to speak. If you've had laser therapy, surgery, or even if you've had freezing treatment to the angiofibromas within 6 months, we wouldn't take you because it might blur the results of the study. And any other clinical study that someone with TSC is taking part in might clash with what we're doing, so we won't accept them into the trial. And of course, if you're pregnant or breastfeeding a baby, we wouldn't think that was necessarily a good thing in case there's a safety problem we haven't known about before. If you've got immune dysfunction or you're immunosuppressed, your immune system suppressed either through treatment or another illness, we wouldn't think that was safe. And as I was saying, we wouldn't take someone with really, really severe disease or really, really mild disease. So the study involved 8 visits to clinic, and they're monthly visits. 6 months of actually applying the cream once a day at night after washing the skin, and then recording in a diary when you've put the cream on and whether you felt anything like stinging or burning, or whether you just felt nothing. There are blood tests and photographs taken of the facial skin at each point along the study at each of the visits, and a doctor will see you each time. The good news is that even though there are blood tests scheduled into each of the visits, there is only a minimum of 3 blood tests that are needed. So that's the absolute minimum to be safe. So people who've got problems with needles or really scared of blood tests don't have to have all of the blood tests that are programmed into the study. And the sponsor of the study has said that anyone in New Zealand can take part, so you don't have to be living in Christchurch or in Canterbury, and they'll reimburse the travel costs. Of course, we're in a really lucky position in New Zealand because of the coronavirus. Most research centres have had to shut down and no clinical trials have been able to take place for many months in other centres, but we only had an interruption of about 6 weeks. So we're going to be able to have much more activity in terms of continuing the study than other centres in America or in Europe. So we're quite in a lucky position in New Zealand. So keen to invite any New Zealanders with TSC. So if anyone's interested, the trial is formally registered at the main trials registry where all clinical trials need to be registered. And we have, of course, ethics approval through the New Zealand Ethics Committee to conduct the study here. And there's my email address, and the email address is my 2IC. Her name's Melina Storer, and she's a PhD who's a research nurse helping me with the study in Christchurch. Thank you.
Thank you. That's really, really interesting to hear, and really great to hear that it's open to everyone all over New Zealand now. So yeah, it's going to make it a bit more accessible. A few trips to Christchurch for people, you know. Yeah.
What we've done, people have come like on a Friday and then had a long weekend, and then gone skiing or gone up in the Springs or something like that. So they've organised that, you know, so that they can actually do something while they're here, and they've quite enjoyed it.
Yeah. Oh, it's really cool, and it's just, yeah, so exciting to have some New Zealand-based research with, you know, finally taking part in these clinical trials, which we have seen from afar, and yeah, really great that there's an opportunity now to take part in that global, yeah, activity that's improving the lives of people with TSC. Yeah, so thank you for your contribution to that and for presenting to us as well.